Hi everyone, Dr. Alexia here, Naturopathic Doctor at Proactive Pelvic Health Center, and today I want to talk to you about PCOS, a common condition that I often see in patients. So PCOS is known as polycystic ovary syndrome, and you might be thinking, well, I've never been tested for polycystic ovaries, or I don't think I have polycystic ovaries, so it's likely that I don't have PCOS. And I wanted to break that myth. PCOS is a metabolic and endocrine disorder, and you often need 2 out of 3 of the Rotterdam criteria to be diagnosed with PCOS. So let's take a look at what that criteria entails. The first criteria is that you are not ovulating during your period, otherwise known as anovulation, or you have irregular periods. So these are periods that are happening outside of that 21 to 35 day window. Oftentimes the periods may be a lot longer in length, so you might be experiencing a period that's either 32 to 42 days, or you may not actually be experiencing a period at all. The second criteria is elevated androgens. These are male hormones which are, normal to the female body, but sometimes they can actually be a little bit higher than we want them to be. So in order to determine if you have high male hormones is getting a blood test. And so you're taking a look at free testosterone, total testosterone, sometimes even sex hormone binding globulin, DHEAS, and things like that. Also, what can happen is you might notice male pattern hair growth, you might notice male pattern hair loss, especially in that frontal area, or you might experience a lot of acne, whether that be acne on your chin, acne on your back, and the male pattern hair growth that will often present, it would be on your chin, your upper arms, your upper legs, your lower abdomen. You may also experience it on your lower back as well. A really good tool to take a look at is called the Ferryman-Gallwey score, and this will give you an idea of what hair patterns to look out for. And the final criteria, of course, is a polycystic ovaries, and these can only be assessed by a transvaginal ultrasound if your doctor is palpating, to see if there are any cysts on your ovaries. Oftentimes that's not going to be sufficient. An ultrasound needs to be done. So those are the 3 criteria that PCOS is basically comprised of, and you only need 2 out of the 3 criteria to be diagnosed with PCOS. So you can see that you might have irregular periods and you might have higher androgen levels, and that alone is sufficient for a PCOS diagnosis. Because this is also a metabolic issue, it would be a really great idea to get fasting glucose as well as fasting insulin to determine your insulin resistance level. This is also known as the HOMA-IR scale. And the reason why this is important is because if there is insulin resistance in the body, this may actually cause the ovaries to produce more testosterone, which again is elevating that scale. So if you think that you might have PCOS, or if you have PCOS and kind of want to approach it from more of a natural means, there are many tools that we can use, vitamins, minerals, herbs, really dependent on what of the criteria that you have. But I certainly can help you out. Many naturopathic doctors help you out. I would love to see you in clinic. I offer free 15-minute appointments, so if that is of interest to you, feel free to book in with me. Thanks so much, and I hope you have a great day.